I briefly wanted to talk about dry eye and what it means to cataract surgery. Cataract surgery involves changing a lens in your eye that once used to be foggy and putting in a new lens, which is great. The chance of that surgery going well is over 99%. However, the two lenses in your eye, your cornea and the new lens, will work together to focus light to the back of the eye. If the front of the eye is dry, you will not get the result that we're hoping for. Dryness looks like raindrops on a windshield. So if you can imagine when you're driving, you pull your car out of the garage and it's a clear sunny day, no problem seeing through that windshield. But then suddenly the weather changes and it starts drizzling outside and you get these little drops on the windshield of your car. At first, no problem, you can see, but as more raindrops start gathering on the windshield, your vision gets blurry. Light comes in and hits those clear raindrops and starts to spread. And then when it goes through your windshield, you don't have the light focused to the area that you want. So you get this dispersive or kind of fuzzy vision. So I have a picture here. If we look at this windshield here, it's clear. You can see how clear the vision would be through here. But as soon as you add raindrops on one side, the vision is not as clear as it should be. So our goal is to prevent that. When I do cataract surgery, I make small incisions into your eye. So I will sever some nerves, which will come back in the future. But because we live in southern Alberta, because we like to read, watch TV, we're on the phone, and we're staring a lot, dry eye is pervasive in our climate. So we ask to have our patients undergo a dry eye analysis. The way I keep the cornea on my eye clear, the best way to do that, I feel, is to blink. Because when you blink, you have about 40 oil glands in your eyelid and 30 down below. You just need to blink regularly, and then you'll get the oil on the surface of the eye and it will lubricate it and it will prevent you from getting those raindrops. However, some of us have lost those oil glands. So if we look at a picture of the oil glands, this would be normal. You can see these glands are long and leaner. You can see in this case, these glands have kind of been blocked or obstructed. The glands in this case are lost, and here they've been shortened. This shows dysfunctional meibomian glands, or the glands in your eyelid. Down here, you can see you've lost a lot of glands, so they've scarred, and then these glands are pretty dysfunctional. If you have glands like this, or like this, there's different treatments. So the dry eye analysis testing is not covered by Alberta Healthcare. The reason we ask if you can get it is because it shows us exactly where you are prior to the surgery. We know that the surgery is going to make you drier. So our goal is to start the treatments for dry right away. And by doing the dry analysis, we can customize where and how your dry treatments are to go. The dry analysis includes getting an osmolarity, or seeing how much fluid's on the surface. It looks at how you blink and if your blinks are complete or regular. It shows us how good the oil in your gland is and how it flows across your surface. And then most importantly, it shows us the structure of your glands and how we can grade it. So we will briefly speak to you about the dry eye analysis during your visit with us during cataract surgery and in any surgery that could affect your cornea or the lens in your eye, as dry eye will limit your vision afterwards.